this program from a Native perspective. Whether it's a flagpole raising or whether it's an elders conference, if it's important to the people and I make a story out of it, this is the most exciting, wonderful, fun time of my life. Hello and welcome to Heartbeat, Alaska. Hello and welcome to Heartbeat Alaska Native News and Native Information. I'm Jeannie Green. Thank you so very much for joining us. Hello, Canada. Nice to have you with us and our good friends all across the lower 48, the Russian Far East, and of course, Alaska. Today is a really good show. In fact, it's probably one of the most important programs that we've ever aired. It's part 2 on Fetal Alcohol Syndrome. It's a great show. We travel all over the state of Alaska, talk to some good folks whose lives have been affected by fetal alcohol syndrome, which, by the way, is 100% preventable. I'll be back with FAS right after this.
Yeah, I'm Laverne John. I'm from Ketchikan, but I'm from Saxman ANS Camp 15.
I'm Betty Kita, and I'm from Camp 15. I'm A and B. I'm a brother, not a sister. Heartbeat Alaska will be right back.
Hey, you told me to call? So can I stay for another hour or so? 11. Okay, Mom.
Let your kids be who they are, but know what they're doing.
There's a special place in Ketchikan, a place on the hill, Cape Fox Hill.
Hi, welcome to Cape Fox Lodge.
It's a room with a view, rooted in tradition, a place to meet, a place to stay, a proud sponsor of Heartbeat Alaska.
Heartbeat Alaska is sponsored in part by Chugach Alaska Corporation.
Support for this program provided by Blue Cross Blue Shield of Alaska. We've been here since before Alaska was a state, and we'll be here when you need us. We're here. We're with you. Blue Cross Blue Shield of Alaska.
I am an actor. I'm a woman. I'm Native, and I vote. And I don't leave it to others to tell me what matters. To me, every issue is a woman's issue. Every issue is a Native issue. Whatever your issue is, be heard. No boxes, no masks. I am Alaska. You are Alaska. Vote.
my life story when I've been through DYFS for 6 years, that when I was 12 years old, I have been on the run from school and getting in fights and drugs and all. The McLaughlin Youth Center place is for kids, and they end up getting in fights. Staff would be doing the same thing. I've been in and out of McLaughlin Youth Center for 6 years. The system always been unfair to me all the life. I got out of McLaughlin because I got institutionalized, and when I got out was on 4/16/01, and I ended up in here 3 months later because the system always causing me problems I never done. I've been accused of things that I never done, and now I'm up in Seward Correctional Center. And just that, I hope you guys don't end up the same way. Today is 4/5/02. I'm 19 years old, and I will be 20 this year.
A lot of people don't understand FAS like I didn't. He's been treated like a criminal and not getting medical attention or education that he'd need. I was a single mother when I had Charlie, and I didn't know that what alcohol can do to a child. And after he got into DFYS custody, it was several years later that they diagnosed him as FAS.
That the alcoholism level here, or rate of alcoholism, is 4 times the national average, and that there's something like 12.6 births per 1,000 that are alcohol related, or alcohol affected, I guess I should say.
He used to give me kisses and say I love you and sit on my lap and watch TV, and he'd be very happy when we have a birthday party for him. And
I started drinking about 5 and a half, just by seeing my grandparents doing it, and my mom and them doing it, and my brother. Then that's how I started. When I first started noticing when I was growing up, my grandparents drinking, violence going around, and when I started going to school and stuff, I started getting in fights, and I started noticing things. When I started finding out by my mom that I had FAS, and I'd be running away from school because the teachers would pull my ear and stuff, and I knew something was wrong with me or something, and I've been just getting in a lot of trouble, just problems constantly. People getting me mad, like calling me names, and I just started noticing that when you get mad and you have FAS symptoms, you get angry real fast, and you can't stop it.
he ran away from school, jumped over the fence. He got into fights with other boys. And I think he might have stole bikes.
Unfortunately, the story of Sandra and her son Charlie is not unusual, but what is unusual is that they have the courage to face their problems head on. The people of the Bering Straits region are also trying to find the courage to talk about fetal alcohol syndrome.
We still hear to this day that physicians are saying, yeah, it's okay to have a glass of wine during your pregnancy, it helps you relax and all of that, and that is completely not true.
At the recent Bering Straits Regional Youth and Elders Conference, people from all over the region came together to tackle tough issues. The conference was a chance for folks to reinforce their cultural values. It was also a chance to make some real progress on some big problems. Inhalant abuse, suicide, and fetal alcohol syndrome were among the topics covered in 3 days of workshops.
When our people see a drunk on a community staggering, you know what we do? We laugh at them, we nudge, we giggle, and we point at them and say, hey, look, a drunk, and we laugh at them. But that person that we're laughing at could be my own uncle, my own aunt, maybe even my own father, or my mother, or my brother, or my sister. And I'm laughing at it like a joke. It's not a joke. That person I'm laughing at is dying of alcoholism.
For more than 50 years, Frontier Flying Service has been your connection to rural Alaska. Frontier Flying Service, a proud sponsor of Heartbeat Alaska.
Bye, Dad.
Bye, Junior.
From generation to generation, the passing down of tradition has been the native way.
You never eat snow because it'll get you tired.
Survival in the Alaska wilderness depends on one's knowledge of ancient native secrets.
Nowadays we carry this. Always carry it next to your body. It's water.
Purity guaranteed. Aquafina.
You know, we sing for millions of girls, but helping out in schools, that's the real deal, baby.
I know our love can multiply.
I'm the cute one, you know what I'm saying? Have you ever been backstage before?
'Cause you're the excel.
I think you'll find that gravity is key in what I do.
Once was one, but now we're two.
I'm spinning out of control.
Oh.
Abdullah FAS case manager. FAS Gangya.
Ursula said we're here to talk about fetal alcohol syndrome. It's a very hard subject to talk about. It's hard to admit that it happens. We're all affected by it. FAS occurs in every community on our planet where there is alcohol and there are women of childbearing age. It's important to keep that in mind. There are 3 things about FAS that I'd like to share with you. One is that women who drink alcohol while they are pregnant are not purposely trying to harm their babies. Second, that I believe that children born with FAS and born into our communities were sent to us to teach us a lesson about what's missing in our communities or what's not working right. And thirdly, that FAS is the only birth defect that is 100% preventable.
I felt guilty and I denied the fact. I think I was more in denial than anything else. And it hurt me to find out that it was my intake of alcohol that caused this problem. And it still hurts today.
In October of 2000, Alaska was given a 5-year, $20 million grant to start looking at FAS to help with prevention and to help start diagnosing it. across the state.
FAS is fetal alcohol syndrome, and our understanding of that has been that there's actual physiological signs in the individual's face that they had prenatal alcohol exposure. So you're seeing the actual physiological symptoms on the facial features. So an FAE is...
It's a disability that happens when the mom's drinking, and it's a hidden disability, I should say, and you can't really see it when an infant is first born until they start going to school, and you can see it by their action, and the teachers, the parents, caregivers, or whoever is working with the child see all these and present these, notice what is going on with the child.
When you do something, it's like you don't think. You just do it right on, and you don't even think about consequences. Nobody tells you not to do it. You just jump to it and just do the thing, and that's what happens. And you just get in trouble with the law, and the law just being unfair with you.
Charlie's very afraid today. He's in jail. He's scared, confused. He doesn't know how to write that well because his educational needs hasn't been met. And he's been abused in jail. He's very scared, and he prays and asks God to help him.
When Heartbeat Alaska returns, we'll take a look at a community in Southeast Alaska that's ready to battle FAS head-on.
See you later, Ma.
Jason,
Yeah.
who else is going with you?
Anna and Kyle.
And you left the phone number?
Yes.
Be back before 11.
Let your kids be who they are, but know what they're doing.
Heartbeat wishes to thank Hagelin Aviation Services Incorporated for making our stories possible. We travel on Hagelin Aviation, and we thank you for choosing them too. Hagelin Aviation has been serving Alaskans in the bush for over 20 years.
We fly Hagelins all the time.
Operating with 29 aircraft at 8 stations across Alaska and servicing over 100 destinations daily. Hagelin Aviation, your ticket to ride in rural Alaska.
Ketchikan is another community that is starting to move beyond the fear and shame of talking about FAS. The Ketchikan Indian Corporation is just putting the finishing touches on a new state-of-the-art clinic and tribal building. Up on the 4th floor, you'll find Debbie Fredricksen. She's helping to form a diagnostic team for Ketchikan. The team will draw on experts that live in the area to help alcohol-affected children make it through the storms of life. The team will be made up of doctors, education specialists, and social workers. Since fetal alcohol damage affects each individual differently, diagnosis is much more complex than a simple yes or no. The team will try to discover what parts of the brain were damaged by alcohol and find ways of teaching that work for each individual. Debbie also hopes having a team in Ketchikan will do more than just help individuals already affected.
I think one of the things that I am most happy about with the diagnostic team is that having it here is going to bring community awareness. It's a child, typically what the case, or typically what happens is providers see a child who is affected as being defiant, which is inaccurate, and unfortunately that is a stereotype that is currently available right now for all children that are affected. And so I think that having the team here is going to bring community awareness that children that are affected have neurological brain damage and they're not being defiant, and that we're going to be able to provide services as a team versus in isolation. And so the child is going to be able to get services from the school as well as mental health providers, as well as nurses and doctors. And so they're all going to be able to meet together and say, this is what we need for this child to succeed. And each plan needs to be really individual.
Debbie knows mothers like Sandra, and she knows the kind of sadness and guilt that can fill their hearts.
I wish I could turn back the pages and change what has been done in Charlie's life. I feel really bad. I wish I could have been more aware of his condition and their form, and I wish all his needs would have been met as a FAS child. If I know what I know today, you know, I would have pursued those issues with DFYS and the probation officers.
Debbie hopes that the team in Ketchikan will help ease some of those burdens.
I think one of the major advantages of having the diagnostic team here is that the diagnostic team will also be a part of the treatment team, meaning after the child is diagnosed, they're going to be able to work with these same providers as far as a plan after the child has been diagnosed. And so they'll be very familiar with the child if they've already gone through the process of seeing this child in the diagnostic clinic. And so I think it's going to be wonderful to have the diagnostic team here, not only doing the diagnosis, but also providing the services for the child.
A strong team like the one in Ketchikan could have helped Charlie cope with some of his problems as he grew up. Thankfully, a team like the one in Ketchikan just formed in Dillingham recently. The state of Alaska hopes to have 15 such teams around the state by the fall of 2002. And hopefully, with FAS teams in place across the state, we can begin to break down the walls of secrecy and shame that keep families in the dark about FAS.
It's a very, very painful subject to talk about, even more painful than suicide. I mean, it's just, there's a level of guilt and shame and inability to forgive yourself for doing an actual damage to your own child, whether you knew it or not. So.
And on top of that, you know, FAS is not something that you can easily talk about. I think it takes a lot of courage, you know.
It was one of my fears and griefs that I worked on while in treatment, and a child has unconditional love, and he always still calls me mom and say I love you, and he tells me, you know, what's bothering him and how unfair he's being treated and how he wished that he could be home with his family and help my mom and dad out, because they're getting old and he always wants to be there to help them out.
We're changing the environment. We're not trying to change the child. And I think that's what's going to be really successful about our community approach in this project.
My future is that if I get married and have kids, I'm not going to be drinking, I'm not going to be smoking pot or doing any drugs, because I know what it goes on with the kids. I seen people doing things bad like I used to do. Now I'm trying to change my life because I don't want my kid to be like me.
Thank you so much, everyone involved with this story, and thank you, Diane Casto, and the rest of the FAS team from the state of Alaska. We really appreciate your help in getting this information out to the viewers of Heartbeat Alaska. And thank you all for joining us. We'll see you again next week with more Native information and Native news. God bless every single one of you. We'll see you then.
Hi, my name is Alwyn Kanuka. I'm from Gamba, Alaska, and I love Heartbeat Alaska. Welcome to Nome.